we are going to tell about the instruments required for laparoscopic pyeloplasty. We have with us Janani sister, who is a very senior sister and experienced sister, and we have with us Dr. Hira, who is a pediatric urology fellow. So before starting any case with the lap pyeloplasty, the day before, what do you want to prepare? What you want to know about the patient, about the condition, about what else? What are the preparations you do as a scrub nurse?
As a scrub nurse, we have to know the age of the patient.
Super.
Age of the patient, the weight of the patient. Then instruments required for the whatever case you have posted, whether it is pyeloplasty or hypertrophy, whatever case. Depend upon the case, we have to prepare the instruments. First, we have to arrange the monitor. The instruments depend upon the age and weight of the patient. If it is below 5 years, means 3 mm instruments, 3 mm lap instruments we have to get. If it is above 5 means 5 mm lap instruments we have to get. Then instruments of breathing we have to prepare. Then depending upon the age of the patient, we have to prepare the stent sizes. If it is between 5 below 5 means 312, 310 stent is enough. If it is above 5 years means 416, 418 stent we have to prepare for this patient. And then
Monitor, availability of the monitor, then whether the surgeon needs recording, that recording facilities. Anything else you want to say in the preparation?
As much as she had told,
Okay.
then the type of instruments what we need. Basically we need those.
So you have to talk to the team regarding the suture materials. What suture materials? Now today's case, you explain about today's case. What is the age of this patient?
2 months.
2 months old. What is the diagnosis?
This lady has got the right-sided pelvic.
So in a right-sided PU obstruction in a 2-month-old baby, and the function is, what is the function?
39%.
39. Can you get that thing and show me the DTPS scan? So you don't go there. You be here. So this is the DTPS scan of this patient, where you can see an obstructed curve, and then the function is like reduced. Okay, and then the AP diameter of that pelvis is already like 39 millimeters. So that is the reason we are doing this. Now, in this patient, what is the size of the stent which is needed?
So since it's an infant and 2 months old, we would require 3 French and 10 centimeter.
So do we have both today?
We are having
So we have both today. Then what are the instruments we have? Can you please show what are the instruments we have? So we have the 5 mm telescope, right?
Yes, sir.
And then 5 mm trocar. Can you show the 5 mm trocar? So that is the 5 mm trocar we are having. And we have a 3 mm. That is a 3 mm.
3 mm proper for assessing for instruments.
So okay. And show me the instruments. What are the instruments you have?
We are having bubble holding.
Ball holding
Bubble
forceps.
holding forceps.
Then
Non-toothed forceps with ratchet.
okay.
Forward.
Then what else we
Then
have?
Netherland forceps.
Netherland
With
forceps.
ratchet.
Then what else we have?
Then 2 bubble holding we have.
Okay. Needle holders.
Then scissor
Scissor, curved scissors.
for
Okay.
cutting the urethra.
Then what else we have?
Then hook.
Super. Yeah.
Then suctioning. Then needle holder.
There are 2 needle holders. One is straight and one is curved. Okay, that's fine. Okay. Now show me that 5 mm telescope. Is that what is it? 0 or 30?
0 degree.
So what do we normally use? 0 degree or 30 degree?
30.
Why do we prefer 30 degree?
So that we can, for putting the port also, we can save the time.
So most often it goes, the port goes from the roof, so you have to see what is below. So 30 degree is always better. You can rotate it when you are putting the instrument. Okay. Now you have some other instrument there. Can you show me what is this? This one. Yeah, that one. So what is this? Why do you have it?
Compact cystoscope.
Why do you need it?
So basically, our policy is to check the stent position after we insert the.
After the inserting the stent over the lab.
Okay.
So we
For
do a
checking
check
the-
cystoscopy to
Copy
check
we
if
have.
the
Now
stent
what is
is
the other way this can be useful?
In case if it is
Stent removal.
no.
The stent does not go.
If it is not passed,
You
then in
can
that
put
case,
a cystoscope
and then put a
from below. So if you put a stenting from below or above, in addition to that stent, what else you need? No. To insert the stent, in addition guide wire. So you have the guide wire. Can you show the guide wire? So what is the size of the guide wire we have?
We are having 0.18
So 0.18 guide wire is there.
Then 0.25.
But that will not go in a 3 mm, 3 French front.
Yes.
So we are using a 0.18 guide wire. Very good. And what about the suture materials? Can you show the suture material? What all suture materials do you have? Mainly for the pyeloplasty, what suture material we have?
50 vicryl double arm.
Just show it. No? So we have the suture material 50 vicryl double arm. So we use it because one anterior layer can be used with this and posterior layer can be used with. Now what else we need at the end of the procedure or the beginning of the procedure? We need to empty the bladder, right? So so we can either use a feeding tube or what can we use?
Silicone catheter.
Police catheter. So in a baby you either use a 6 French or 8 French catheter. So we have to arrange all these things and then only then you are very well prepared. What about the antibiotics? We can have antibiotics
Yes,
also.
sir.
I think we have got the antibiotic here there.
Yes, sir.
I think
Before the injection.
cefotaxime is there. Then we have what else here? So you show here. So we have lot of feeding tubes here. We have that Foley's catheter. We have the antibiotic. Then we have this tissue sealant. So at the end of it, a 3 mm port can be closed with this. So we have all this, and we also various suture materials like one size above and below. All suture materials are there. So this is for skin closure. So that is kind of complete setup. Anything else you need to know on the day of surgery, like after the patient is induced, what do you check? Again, you have to check something. Pre-check, like when you time out, you have to check out what are the things you check out.
One is the antibiotics, then the instruments.
Side. So you always mark the side and check the side and then make sure that the patient is positioned accordingly. Then your instruments are working or that these things are working. And if your monitor is not working or instrument is working, what is the backup? So you need to have everything in plan and only then your procedure will go very well. Anything else? Very good. Thank you very much.